Hi, everyone. My name is Lynn Hernandez, and I'm with the Desmoid Tumor Research Foundation. Welcome to our webinar tonight, which is the first part of a two-event series for adolescents and young adults. It's called The Times Are A-Changin. Our aim in this webinar is to offer some tips and tricks, courtesy of Dakota Fisher-Vance, who is a young adult living with a desmoid tumor. In the chat, I'll be posting a link for you to sign up for part 2 of The Times Are A-Changin, a virtual networking event for adolescents and young adults who are desmoid tumor patients. This will take place tomorrow night, Wednesday at 7:30 p.m. Now I'd like to introduce you to Dakota, who will be speaking with you tonight. Dakota Fisher-Vance received her bachelor's degree in biology from Bryn Mawr College in 2011 and a familial adenomatous polyposis, or FAP, diagnosis 2 months later. Reluctantly, she traded her post-college job for surgical gowns to have her cancerous colon removed. While working abroad in 2013, she was diagnosed with a desmoid. Dakota is currently the Associate Director of Global Patient Advocacy at BioCryst Pharmaceuticals, where she ensures that the voices of rare patients and the nonprofits that serve them are heard and supported. She's the co-founder of the Young Adult Cancer Connection, or YAC, which hosted Cancervention, Philadelphia's first young adult cancer conference. She's also the creator of Fabulous TV, the first YouTube channel dedicated to discussing FAP. She led the community engagement team for 3 years at Rare Life Solutions and served on Horizon Therapeutics' patient advocacy team. The other diagnoses she contends with include an active chocolate addiction and the travel bug. So welcome, Dakota.
Thanks, Lynn. All right, let me see if I can share my screen.
Yeah, I'm gonna just go over. I have a couple instructions for everyone before we get started. So we welcome questions via the Q&A. You'll see the Q&A icon at the bottom of your screen. It's in green. So if you have a question for Dakota, you can just share it there throughout her talk, and she will try to get to it at the end of her presentation. Also, you'll see that the chat function is open for your use to communicate with your community members. Please note that the chat will not be monitored by us, so if you have any questions, make sure that they go in the Q&A. Now I'll hand things over to you, Dakota.
Thanks, Lynn. All right, here we go. All right, hopefully everyone can see my screen. All right, so as Lynn mentioned, my name's Dakota Fisher-Vance, and I am very excited to be with you today talking about a topic I'm super passionate about, which is heading into young adulthood with the desmoid tumor. First, a quick disclaimer. You'll see a bunch of resources shared and listed throughout the presentation, and not everything listed is desmoid specific or something that is associated with the Desmoid Tumor Research Foundation. And of course, this is not intended to provide medical advice in any way. Okay, so before we dive too deeply in here, I thought we'd start with just level setting with some baseline stats, like who are we talking about when we say young adults? And of course, who's talking with you tonight? So beginning with some questions that I'm guessing most young adults with the desmoid are familiar with, such as, why me? Who am I? So as Lynn had mentioned, back in 2011, I graduated with a degree in biology from Bryn Mawr College, which is based out here in the suburbs of Philly, which is where I'm currently based. And then shortly thereafter, I was diagnosed with an FAP diagnosis. And at the time, I was studying for the medical school admissions test, but that sort of changed things. So I needed to trade in my post-college job to have 2 surgeries to remove my cancerous colon. Certainly wasn't part of the post-college plan. And then right after I was working abroad, I was diagnosed with a desmoid in the summer of 2013. Statistically speaking, I'm about 4 in a million. And of course, as you can imagine, a identity crisis definitely set in. But eventually I started trying to piece things together and figured out how to translate some of my personal advocacy skills into my profession. So I created a YouTube channel for people with FAP. Eventually, I co-founded an organization for young adults with cancer out in Philly. And then I've been working in sort of patient advocacy and engagement at and with pharmaceutical companies since 2016. So I swear I'm not just some random person that Lynn found out on the street. All right, now you know who I am. Let's start narrowing in on who we're talking about right now. The definition of young adult with a desmoid really varies, but it definitely spans a wide group. I've heard somewhere from, sometimes people will say it's ages 16 to 25. Sometimes people will say it's ages 18 to 39. So really there's not, sort of an agreed upon scientific definition, but generally speaking, it's when you start to feel too old in that pediatric setting and too young in an adult healthcare setting. Oftentimes you're also starting to come into new responsibilities as well as independence. And of course, as you can imagine, when we're talking about a wide age range, it covers a lot of ground from, entering college or some sort of training after high school to getting your first job to dating and all the way to starting your family. So we're definitely talking about a lot, and we're going to delve in into each of these sort of milestones a little bit more later on. Okay, so we've set the stage here. Before we go even further, and I think we need to sort of talk a little bit more about that process of entering young adulthood, and also really probably one of your greatest, most powerful tools that you have as a young adult with the desmoid, which is self-advocacy. So throughout the world, there are all sorts of different processes and ceremonies and names for sort of leaving adolescence and becoming a young adult. And it just so happens that in the medical world and the hospital world, the name for that is called medical transition. And the official definition of medical transition is the process of moving from a child to an adult model of healthcare with or without a transfer to a new clinician. And so this idea of medical transition was introduced in 1984 by this strapping gentleman shown on the screen, who's Surgeon General C. Everett Koop. And it was in response to his pediatric rare disease patients that were starting to live longer and sort of outgrow childhood. So fun trivia fact for you is that, sort of this focus and this whole concept of medical transition and becoming a young adult with a chronic illness emerged because of rare disease. So back in 2007, medical transition was declared a top 10 priority by the American Academy of Pediatrics. And there was a clinical report in 2011. However, the 2018 update on that report led in noting that essentially there'd been a total lack of progress. In 2018, only 15% of youth with and without special health needs received transition planning assistance from their healthcare providers. And on top of that, rare disease is not specifically mentioned in any of the reports. So all that to say, there's still a lot of work that needs to be done here. And because of that, as we sort of, wait for the, medical world to catch up a little bit and do some of this important research and work, a lot of the responsibility falls on your shoulders. You really need to advocate for your needs because as you can sort of see here, the medical system isn't necessarily going to do it for you. And how do you do that? Well, by working on and starting to flex your self-advocacy skills. Again, I really think this is the most crucial part to becoming a young adult with rare disease. It really can help empower you. So self-advocacy rests on essentially 5 main skills. The first of which is information seeking. So that can be learning about desmoid tumors. It can be finding about and starting to get to know who your healthcare team is, the different specialists and players. And it can also be discovering different support resources like DTRF. Then there's communication, which is discussing important information, not just with your healthcare team, but also with your friends, your family, perhaps your colleagues. It could be sharing your Desmoid experience, whether it be at events or on a blog or in an interview. And then problem solving is where you're making decisions about your disease management. You're creating and you're acting on a care plan. It could also be getting involved with groups like DTRF to try and figure out how you can help, the community and help solve for their problems. On the negotiating end of things, that could be securing reasonable accommodations, whether at work or at school. It could be appealing a health insurance decision, or pursuing a disease management approach that best fits your lifestyle. And one that I think is really easy to forget, but it's important to keep in mind is self-care. And that's celebrating, the accomplishments, the wins as you manage your disease. It's also setting aside time to do nothing healthcare related. And of course, asking for help. There's no shame to it. And of course, being a young adult with a desmoid comes with some unique self-advocacy needs. There's the whole element of a lot of times you need to transition from your pediatric oncologist or provider to an adult provider. So in order to do that, you need to try and figure out where are the adult providers who actually know anything about desmoids. Fortunately, we have the DTRF Physician Finder, which can sort of help there. So if you've never checked that out, definitely a good place to start. And then once you find knowledgeable providers and you're like, yep, I'm going to go with them, you have to do the arduous process of transferring all of your medical records to those providers, which can definitely be a challenge. And then just giving them the medical records isn't always enough. You have to make sure that you're educating them about your history. There's setting up emergency contacts and HIPAA authorization, which is essentially, once you turn 18 and you become a legal adult, giving access to people you'd like to be able to access certain private health information about yourself. And if you're lucky, something to try and ask around for is if your healthcare system has a transition program. A lot of times, programs that have both a pediatric as well as an adult hospital that's sort of under their ecosystem have these programs that can sort of help you do all of this stuff, or at least start talking to you about this. Usually you'll find them at sort of like more big name hospitals. So definitely worth looking into. It's still sort of a newer thing. You're not going to find it at every healthcare system, but no harm in asking, right? And then something that is definitely unique to the young adult stage of having a desmoid tumor is when you hit that magic age of 26, you can't be on your parents' health insurance anymore. So you might need to find a new health insurance plan for the first time in your life. And another thing is, unlike older, patients, people who are diagnosed later in life, if you're someone who is looking to consider starting a family, you're going to need to work with your healthcare team to make sure that they talk about what path to parenthood could look like. And this kind of conversation, unfortunately, tends to get overlooked because a lot of times oncologists and surgeons, they're not used to working as much with patients who are younger. All right, so I'm going to sort of flip the script a little bit momentarily here. I'm pretty sure everyone on the line is a young adult or an aspiring young adult, but just in case a caregiver or parent snuck on the line, I just wanted to provide some tips on how to start passing that sort of leadership baton and helping the young adult or the teen in your life start gaining some of these self-advocacy skills and independence in managing their disease. And for the young adults in the room, if you're, struggling to figure out how you start taking more of a leadership role in managing your care, you can pause the recording of the webinar right here and bring this to your parents or your guardian and try to talk through what might be possible here and use this as some inspiration. So first, parents and guardians should start practicing treatment administration and management together. That's a good way to start, getting someone to learn how to make sure they're scheduling their treatment and make sure they know what to do, all that's involved. As we talked about, there's a lot of sharing your desmoid history, especially as you acquire new providers. So you want to start practicing sharing that desmoid history and make sure your teen in your life has the digital or a hard copy of their desmoid history. You want to start preparing together in advance of medical appointments and let the teen take the lead in the appointment. I know that's a hard transition. You're probably very used to sort of being the one that's sort of guiding the conversation, asking the questions. But again, it's important to make sure that in addition to you talking to the doctor, that the doctor's also talking directly with the teen as well. Um, if you're calling insurance companies, make sure to have the teen listen in so they can start learning their insurance terms. It really is like a totally different language, and it's one that's really essential to learn as you start taking responsibility yourself for getting access to care. And then, gather together after medical appointments and reflect on them. This one is a big one to me, which is, once your teen becomes a young adult, a legal adult, start letting them attend medical appointments on their own unless they request companionship. I know for me, this is one that it took a while to work on with my parents. I'm talking like years here. But at the end of the day, it really is the young adults' relationship with the doctors. This is their relationship that could be a lifelong one, and it's important for them to start developing it on their own terms. So again, I know that that one's a challenging one, but definitely one I encourage. But that doesn't mean that as the parent or guardian that you just totally need to step away and sort of, wash your hands of all this. Keep up to date on what's happening in the Desmoid world. Stay involved with DTRF. That helps you sort of have the finger on the pulse of the Desmoid community. And then I know young adults are notoriously bad at calling home and talking with their parents, but work with them to make sure that they're periodically updating you on their Desmoid experience as needed. And young adults out there, make sure to call home. They like to hear from you. And just in general, pro tip, it is never too early to start practicing and preparing for self-advocacy skills. These are skills that are going to last you well beyond young adulthood and also really help out, not just in managing your Desmoid, but just life in general. Okay, so now we know what self-advocacy is. Let's start talking about how we use these skills as we start achieving different milestones throughout young adulthood. First things first, moving out, and perhaps you're heading off to college. So I've always been taught don't leave money on the table. And I know there aren't a lot of perks to having a desmoid tumor, but you could possibly get some scholarship funding as a result. There are a lot of great scholarships out there that are available to people who have chronic illness, to rare disease, people who have cancer. Don't forget about checking these out as you are applying for college funding. And then, all right, once you're in college, it's important when you get there to try and scope out a local desmoid provider, perhaps someone who has some familiarity with desmoids, just in case something comes up while you're there. Make sure on campus to introduce yourself to the health clinic. Again, just in case something happens. And then be sure that you're coordinating the care that you're getting on campus with your home desmoid healthcare team. A good time to try and get medical appointments in is during school breaks, but of course, those are the times that tend to fill up quickly. So make sure you schedule well in advance for them. And then if you do have some sort of medication that's delivered through a specialty pharmacy, you want to update your mailing address with them. And you're going to want to connect with your school mailroom to make sure you can come up with a good treatment pickup plan. And then always good to just have documentation ahead of time, whether it be documentation confirming your diagnosis or documentation of what prescriptions you have. Just never hurts to have that in your back pocket. And then a really good resource that you're going to want to connect with even before you end up choosing where you're going to go to school is the Office of Disability Services. So again, make sure you meet with them in your college search because they can help orient you to what resources are available to students who have desmoids or chronic illness in general. And then once you're there, you're going to want to connect right away with them and work together to try and secure any reasonable accommodations that you might have, and also to inform professors. Something to keep in mind is that if you have an IEP or if you have accommodations while you're in high school, there's no guarantee that they're going to just automatically transfer over. And in fact, you have to try and, go and advocate for them. So definitely a resource you want to get in touch with pretty quickly. Generally speaking, when it comes to sharing about your diagnosis and disclosing, I believe it's an extremely personal decision. It really is up to you. That being said, in the case of your roommate, I might suggest considering sharing that you have a desmoid and perhaps with some close friends as well, just in case there's an emergency, something happens that they're aware. And in the case of your roommate, it could be helpful for them to know so that they can respect any special needs you might have in the room. Perhaps you need to take a nap in the middle of the day, or you're very strict about when you go to sleep because of fatigue or what have you. Or maybe you're immunocompromised and you need to make sure things are really, really clean. These are just all things that it might be helpful for a roommate to know so they can sort of help you accommodate all of this stuff. And I know it's a lot, it's very scary. So if you're hearing all of this and you're feeling super overwhelmed, that's okay. Maybe before moving out, try practicing getting out of your comfort zone ahead of time. So that could be maybe going to an overnight camp for a week, or it could be something as simple as taking a weekend trip away. And that just helps you, practice managing your disease outside of, where you're used to living. And a lot of times what you'll see is even if something happens, even if there's, emergency or you don't feel or something comes up, you'll realize that you are capable of adapting and figuring out what you need to do to resolve it because, well, what other choice do you have? So it's a good way just to start getting more comfortable with yourself being in different situations. And then also don't forget, of course, there's community college and there's part-time college. So just those can be great ways to sort of dip your toes in the water and get comfortable with it while, maybe you're going through treatment and you need to be closer to home or you're just not sure if you can handle, full-time. Good options not to forget. Okay, so you moved out and you're looking for your first job. I think, we have to start again with that topic of disclosure. The first thing you really need to think about, even before you start applying for jobs, is whether or not you are going to disclose your diagnosis to a potential employer. Generally speaking, by law, you are not required to disclose about your desmoid or any other medical condition in the hiring process, and they shouldn't be asking you as they're doing the interview. But of course, keep in mind that, I'm sure we've all heard, right? That what goes on social media is forever. And that if you have posted about your diagnosis on social media or elsewhere, that could possibly be discovered by an employer. So just again, keep in mind whatever, if you're going to post about your diagnosis online, that could have some ramifications down the road. Um, you know, Generally speaking, again, it is truly a personal decision on whether or not you disclose in this scenario. I think everyone handles it a little bit differently. The question I'd ask you to sort of consider that I think really can help frame whether or not it's going to make sense for you is, would disclosing my diagnosis help me in any way? I know in my case, I think I might be an anomaly, but first things first, I mean, all you have to do is Google my name and you can quickly learn a lot about my medical history. So that sort of freed me up a little bit as I was applying for jobs. But also, I was in a situation where, I was applying for jobs to work in patient advocacy at a pharmaceutical company. So my experience being a rare disease patient actually, added valuable skills and was pretty directly translatable to my day job. So I think it made a lot of sense for me to disclose in the interview process. But also there's the other piece of, is disclosing going to help you get the accommodations you might need? So that's also something to just keep in mind. There's no real right or wrong answer here, unfortunately. And then let's say you interviewed and you get the job. Awesome, great, congratulations. When you're looking at what are all the benefits, don't just look at the salary. Be sure you don't overlook the overall benefits package, and make sure you work with HR to get any questions you might have. So for example, if the company offers a disability or life insurance, are there any medical lookbacks? Because unlike health insurance through the Affordable Care Act, there can still be, pre-existing condition clauses for other types of insurance. What are the sick days like? How much is the health insurance plan there? Your salary may be going way up, but is your health insurance cost also going to skyrocket? And if so, where does that all net out? When you have a chronic illness, the benefits really, really come into play. And I've actually used, I've negotiated based on benefits that I had at one job offer to try and get, a better salary at another. And then again, we come back to the accommodations piece. Before you even, start the job search process, start thinking about what are reasonable accommodations that you might need. If you do need accommodations, you're going to need to find a way to discuss them with your supervisor and HR. And there is a way to do this without disclosing, hey, I've got a desmoid tumor and like I get, treated with this treatment. You can say something like, I've got a medical condition that requires me to work remotely once a month, stuff like that. So, maybe you need a flexible work schedule. Maybe, again, you might want to work remotely. There are all sorts of things that might come into play here that you just want to think about and be aware of ahead of time. And then, something to keep in mind is if you are on any government benefits like Social Security disability insurance or Medicare, you need to be aware of how employment could potentially affect your access to those benefits because some of them have annual income thresholds. And, again, if you're hearing all this and you're just still feeling really, really unsure about entering, the workforce full time, don't be afraid to test the waters with some part-time work or doing some volunteer work. I know for me, after I was diagnosed with my desmoid, I started my career doing part-time work. And, at the time I was really embarrassed by it because all my 20-something friends were, able to handle working full-time, no problem. And here I was really, still adjusting to treatment and just, not always feeling the best. And while I felt really guilty and embarrassed by it at the time, when I look back, I'm really glad that's the route that I went and that I didn't just start full time and go head on in because it allowed me to one, build up my stamina, but it also allowed me to build up my confidence and realize, hey, like, what, I can do this. I think I might be ready for more versus maybe starting full time and feeling so overwhelmed and so drained and, just getting totally burned out right from the beginning. And then I think I'm probably like the poster child for this, but remember the path to the perfect job is rarely straightforward. Yeah, my career is very, very nonlinear, and that's just something to keep in mind. Obviously, having a desmoid can create some twists and turns, some pauses, and that doesn't mean that you're not going to end up with an amazing, amazing career. Okay, moving on to relationships and friendships. So again, I know I'm probably sounding like a broken record here, but you need to try and determine whether and when you'd want to disclose your diagnosis when you meet new people. If ultimately you decide you would like to disclose your diagnosis, it's helpful to have a list of shareable resources that explain what desmoids are, because chances are, your friends may not have any idea. DTRF can certainly help you with that. I wish I could say it's all sunshine and rainbows, but of course, you got to be prepared to encounter some elephants in rooms. There definitely are awkward conversations. Your friends will put their feet in their mouth. It happens, it stinks, but, it just sort of comes with the territory. Something that I found really helpful and took me a really long time to learn this is trying to be able to provide guidance on how and when you're comfortable discussing your health. Perhaps you're really open with people just asking you questions whenever. That's great. Let your friends know so they're going to be more open to, talk with you about this and they're not going to be as afraid. But perhaps you really, sometimes you do want to talk with them about it, but you don't want them bringing it up. You want to sort of have it be on your terms. That's okay too, but just, lay that groundwork up front. And then something that's really important also, took me years to sort of realize in the context of having a desmoid and being sick. Your friends and your partner care about what's happening in your life. And sometimes that looks like you got a new job or you found a new apartment. And sometimes it involves more health-related developments. But if they're really your friends or your family or your partner, whoever, they care about you. They want to know. So, don't feel guilty or bad about sort of talking about some of the medical stuff in your life if you need to. And then again, it's important, especially if you do have a significant other, to start educating them about what your desmoid care looks like and even start involving them. There are certain things that certainly are going to come into play when you start dating someone, or start having a significant relationship that may not come into play with your friends. Are there any concerns you have about intimacy? Genetic counseling if you're looking to have kids, and then of course just family considerations across the board. And then, one way to try and get everyone involved to start learning about desmoids and, maybe a space that doesn't feel as, lectury or as awkward or, doesn't put the onus as much on you is getting your friends and family to participate in desmoid awareness events and fundraising events. Again, just great way, one, for them to learn about desmoids, to get to, see a little bit of your community here. But also it's a good way for them to feel like they can help. A lot of times, your friends or your partner, like they want to help, but they don't know how. And participating and being engaged in fundraising, these are all sort of, straightforward ways to sort of get them a little more involved and make them feel like they're engaged in supporting you. This one I'm very bad at, but don't be afraid to ask for help. I know easier said than done. Again, that they're your friends, they're your partner, they care about you. Sometimes we help each other out, right? But also start thinking about how different friends can help in different ways. This is going to sound really bad, but I have a list of some of my core friends, and I've really thought about where each of them can play if I do need help, because I think some of them, are good in some areas, but probably really bad in other areas. Like I have a friend who, if I need to talk to someone immediately, it could be midnight and I just need to, vent or some bad news or whatever. I have, that person in mind. But that person isn't the same person that if I need a ride somewhere, or if I want someone to accompany me to a medical appointment. So again, different friends have different strengths and different, abilities to help out. So just starting to think through that. Again, I know it sounds really terrible, but again, they're your friend base. You gotta, leverage them where you can. And then talking of friends, really big proponent of this last one, which is connecting with other young adults with desmoids through the DTRF as well as young adult cancer organizations. Personally, I credit meeting other young adults who could relate to my cancer experience as being just as responsible for me being here today as some of the medical treatments that I've received. There's nothing like it. Everyone on the line right now is, I'm guessing, unless there's some parents that snuck in here, this is a group of young adults with desmoids who probably you have a lot in common. So don't forsake that resource. There are some really great resources out there that can sort of help you, especially educate friends who may not, have any experience with someone being sick that's their age. I think I got a lot, when I told people that I had this disease, that I had a soft tissue sarcoma. Most of my friends were like, oh yeah, like my grandmother had a sarcoma or something like that. So, it's important to remember that, your friends may not know people your age dealing with this. So there's this great, I'm highly biased because I'm in this video series, but it probably is one of my favorite resources of all time because it's what I wish existed when I was diagnosed. It's a video series called My Friend Has Cancer, and it's specifically designed by all young adults with cancer. It's directed by a young adult with cancer. It's written by a young adult with cancer. All the actors are young adults with cancer. It's, really, really cool piece. And it's specifically designed to share with friends of people who have a cancer diagnosis, and it really sort of walks them through just some of the unique parts of being a young adult and how you can support your friend and things that might come up. And yeah, again, probably one of my favorite advocacy pieces I've ever worked in. So if you're struggling, definitely encourage you to check it out. But also, it can be helpful to just share some general sort of resources and media portrayals of young adult cancer. One of my favorites is a column by Suleika Jawad, who now is like super famous. She's married to John Batiste. But before all of that, she wrote this column called Life Interrupted in the New York Times. And there's also a short video series. And it's a way to sort of share what some of the, the experience is like of being a young adult. I've shared Fault in Our Stars with friends because personally I find that to be an interesting representation. So again, like there's all sorts of different portrayals out there. Read through them and see which one maybe speaks to you that might help you share a little bit more and help your friends relate and understand on some level some of the things you're dealing with. And that transitions us very well to young adult geared resources and opportunities to get involved. I think the coolest part of young adulthood is, I think, you're very eager to just, head into the world and start doing stuff. And I think it's important to try and capitalize on that spirit. And fortunately for you, there are all sorts of ways to sort of show up and get engaged. On just the event standpoint, of course, we've got the DTRF Together We Will weekend, which is pretty awesome. There's Desmoid Tumor Awareness Month, which you can participate in, and I'm sure Lynn and the whole DTRF team would be happy to share ways for you to get involved. And then again, there are some also general resources that are, not necessarily through DTRF or Desmoid specific, but I think are still really relevant, such as the National Conference on Work and Cancer, which is put on by an organization called Cancer and Careers. And hey, if you're feeling really pumped up, plan your own advocacy event, right? Again, connect with DTRF. I'm sure they're very, very open for you to lead something. And then again, there are not a gazillion, but there are definitely some young adult cancer programs that you've heard me say cancer a couple of times. Personally, I'm of the mindset that I believe a desmoid tumor does sort of qualify under cancer, hence why I sort of, I'm suggesting these resources. And I can tell you, if you're someone saying, hey, like it's technically not cancer, can I go to these? Yes, you can. You're not going to get turned away from any of these groups. Stupid Cancer, Omen Fund, Teen Cancer America, all really, really just great organizations to check out. And again, this is all about, finding ways to share your voice, both in the healthcare setting, but also outside. So you can do that all sorts of ways. DTRF has a patient registry. That's a much more formalized way to help researchers by sharing your experience. DTRF also has a way where you can share your desmoid experience through their website. Again, keeping in mind that the internet is forever, you can post on social media. There are resources like Elephants and Tea that are sort of young adult cancer outlets that accept submissions of articles. So again, all sorts of ways to really speak up, get involved, and yeah, meet other people who can relate. With that, I think it's time for questions.
Hey, all right. This is great. Thank you so much, Dakota. Wow. Okay. So I do see a couple questions here. Someone is saying, my friend said something inappropriate about my desmoid tumor. How do you recommend approaching this situation when it comes to my desmoid?
Yeah, definitely a good question. I think that's the social element of having a desmoid for me probably was one of the hardest outside of the medical, the physicality of the medical component. And it's really tough, I think, initially when you're sort of thrown into this one, you are still sort of struggling to figure out how you want to talk about it, what are the right things to say, what makes you feel comfortable. And then on top of it, you've got your friend who chances are probably has never met someone their age who is dealing with a serious illness. And so it is really, really hard sometimes when they really mess up. And trust me, I have had some really ridiculous things said to me by friends. I had friends who tried to set me up with someone else who also was missing a colon because we were both missing colons. I mean, like things like that where you're just like, how do I even respond to this? I don't know. You have to try and give them grace and remember that, oftentimes they're not saying anything maliciously. If they say something and they mess up, it's likely just because they don't know. I think they're trying to come from a good place and really they're just curious and they care about you, and maybe them trying to learn more and figure out how they can best support you and figure out what is going on in your life is coming out and maybe not the best way. And so I think, one, giving them that patience, trying to assume, that they are probably coming from a good place, is helpful. And then I think on your end, trying to figure out, okay, maybe don't, attack them and say, that was totally wrong. Don't do that. Just try, distill what are they actually asking? What are they getting at? And try and give that information back to them in a calm way. And then maybe at the end point out, hey, I think that's what you were asking for, but just so you know, that sort of came off a little odd. In the future, if you're looking for this kind of information, maybe here's how I'd suggest phrasing it. Stuff like that, I think is really helpful. And again, if it gets to a certain point where it is just, you've tried to talk with them, you've tried that approach several times, and it just keeps happening, that's when you maybe get to a place of like, maybe this friendship is just, we need to reevaluate because I just can't get through to them and it's really making me uncomfortable. So
Okay, all right, thank you. You mentioned sharing young adult cancer portrayals with friends and partners. Are there any additional types of resources or pieces that you'd recommend us checking out?
yeah, so I think if you just if you type in, now, again, I don't think there, if I'm going to be honest, are like a gazillion different, young adult desmoid specific resources out there. Hey, maybe that'll change over time with DTRF. But if you broaden your approach a little bit, again, always start more specific when you're doing research and then start, broadening it out with that with anything. So, start looking for maybe young adult sarcoma, young adult cancer, young adult chronic illness. That's going to open a whole landscape of stuff that's going to come up that you might want to, learn more about, you might resonate with. For me, again, I think like things like The Fault in Our Stars, again, that's something I've definitely just given to people. There are several books on, young adult cancer that it's fictional. I tend to, you want to pre-read them because some of them are like more like young adult fiction drama, not so much about the cancer piece or about the, being a young adult dealing with illness. There's, what is it? I think it's like Zach and Mia, I think is on Netflix, which is an Australian book that was put onto like a little mini series. Just look up like what are some of the mainstream representations. Maybe there's as now they're starting to be YouTubers who, this wasn't as much the case back in the day, but they're more sort of YouTube personalities and TikTok and social media personalities who are sharing about their cancer experience. And again, some are going to resonate with you and some really aren't. So pre-screen them and, feel free to share them on. But Salika Jawad, really, Life Interrupted is probably one of my absolute favorites.
Okay, great. Although I'm an adult, my parents and I are both nervous about me going to doctor's appointments for my desmoid tumor. Any tips on how to start and feel more comfortable about it?
Yeah, it's definitely a really scary scary time, I think, for everyone involved. Again, giving your parents or your guardian grace, and knowing that they are trying to act out of your best interest. They're acting with good heart, generally speaking. And they're, if they've been involved up until now, it is sort of scary all of a sudden to say, oh, what do you mean I'm not going to be in the room? I'm not going to be getting the updates on your medical treatment and being able to ask all my questions in live time. But I think, starting, you can start small and go to the appointment together and say, level set with your parents ahead of time and say, hey, I'm going to be, you guys are in listening mode. I'm in talking mode. We can work together and I can make sure I have your questions that you have ahead of time, but I'm going to be the one who's asking them. Maybe then move to, okay, like I'll call you in. So you can listen and you can't be in the room. I've done that. So again, sort of just easing into it and then again make sure that they know that you're still going to update them. Maybe you come up with a plan where you call them afterwards, so that you can share what happened while it's fresh in your mind, and make sure that they know too that you still want them involved in your desmoid life, that this doesn't mean that they're not still a vital piece of the puzzle, but just that, it's time for you to start forging that relationship with your medical team on your own, and that, you'll definitely, reach out to them. You'll be sure to involve them as you need to, and starting to just, again, open that communication up with them outside of the doctor's office so they don't feel like they need to be in the doctor's office to get it. But it's a process. It takes time. I like honestly, like truly my parents like hacked my calendar, I think, so that they could see when I had doctor's appointments. I never told them and they still showed up. So it definitely took time, but we got to a good space.
Got it. Thank you, Dakota. It looks like we have one more question. This attendee says, I haven't told anyone at work about my desmoid, but I'm struggling to figure out how to explain why I need time out of the office for my doctor's appointments. How
Yeah.
do you handle balancing your work and medical calendar?
Definitely a challenge. I think again, keeping in mind that you don't need to disclose. So, is there a general way that you can explain to them why you might need time out of the office? I mean, keeping in mind too that everyone has medical appointments. I mean, even if you're, totally a healthy person, you still have your dentist appointments twice a year. You still have maybe eye doctor and so forth. So again, taking stock of how many appointments you have, sometimes it really is okay to just say, hey, I've got a doctor's appointment. I find, as soon as you get that doctor's appointment on your calendar, which often is months and months in advance, putting it on your calendar and blocking it off is really helpful in just showing yourself as out of the office. And generally speaking, when I say, hey, like I can't move this appointment. It's a doctor's appointment that took months to get into. Generally, colleagues have been pretty good about that. And I think the question, sometimes you don't even really need to disclose per se. Sometimes you just say, I've got an appointment. It's blocked off, and usually there's not too much interrogation that goes along with it. And then I think in terms of just overall balance of like medical stuff and work stuff, I find that, I travel a lot for work, and so making sure I spend time to decompress. I think sometimes I do spend a lot more time on sort of downtime after I do sort of heavy work related stuff than maybe someone else. So just, making sure that you're always recharging, making sure you're still finding time for non-medical and non-work stuff. I think sometimes when we have so much medical stuff, it occupies so much of our free time that we just totally get burnt out. So again, just being cognizant. Sometimes you do need to like step back. Maybe it's once a month. You just put on your calendar, like step back, evaluate, think back on my last month, and did I see friends? Did I take a walk? Did I do some things that are just outside of both of these two big commitments I have in my life? Yeah, it's a challenge. I think over time you figure it out, and I don't know. It always keeps you on your toes though.
Okay. Wonderful. Thank you so, so much, Dakota. This was really helpful. And thank you.
Of course. Thank you, everybody.
Um,
It's a pleasure.
yes, and we also thank the Desmoid Tumor young adult community and adolescent community for joining us. So please note that we will be sharing a recording of this webinar after it's edited. Usually it takes about 2 or 3 weeks. If you haven't already, you can visit our website, dtrf.org, to subscribe to our mailing list, and you'll receive the notification when it is on our website. One more thing, and I know Dakota mentioned this, be sure to save the date for the DTRFs Together We Will weekend from September 20th to the 22nd. This is going to be our first year in Houston, Texas. You can learn more about that at dtrf.org. And I just want to thank all of you again for joining us. Dakota, thank you so much for taking the time to share your knowledge and your personal experience being a young adult with a desmoid tumor. I hope everyone has a lovely night. And Dakota, I will be seeing you soon. Thanks, everybody.